If somebody talked to you or me personally in a friend circle about Ozempic or GLP-1 or whatever, it is actually looked upon as a negative thing. People don't even want to talk about that. But the reality is, it is changing patients' lives.
40-50% of the patients on chronic therapies, they discontinue within couple of years, and it's not because of the therapy fail, it's because of the experience.
Expectation from a patient standpoint is, I don't really care about whether your operation is 1-person pharmacy or 1,000-person pharmacy. I still deserve the same person attention and so on.
In pharmacy, if there is a delay in fill or miscommunication, it's not just a bad sprint, it's like broken therapy journey altogether, right?
This industry deserves a lot more visibility.
My guest today has led some of the largest customer organizations in global technology and now brings that same operational discipline into one of the most regulated industries.
Nobody was even willing to talk about men's health, women's health, hormone replacement therapies, testosterone, and so on and so forth.
We saw clearly during GLP-1 shortages, so compounding pharmacies stepped in, and I think Empower was one of the most trusted ones. It filled the gap basically when there was a shortage.
When GLP-1 shortages were there, we came in, filled the space. But now certain states are moving away from some of those and saying, hey, that thing is not possible. But ultimately, we need to understand, if the formulation is safe, if the formulation is shown to show the benefit, then is regulation more important or is the access more important?
What do you think things are going wrong with other pharmacies?